flexion abdominal position with strap, and flexion abdominal position with block. So in the flexion abdominal position, she's going to start on her side. She's going to rotate her body around, and she's going to put her feet on the wall level with her knees. So we're going to go down a little bit more. And we want the butt a little closer to the wall and the knees closer to the head. So the knees are really far past the hip. So this is creating deep hip flexion. So in this position, the feet are hip width apart and the knees are hip width apart too. So we want to keep that line all the way up the body. Palms are up and the arms are out at a 45-degree angle. So this position posterior rotates the pelvis. So this is good for somebody who has an anterior pelvic tilt. Why it's really promoting proper function of the hip and deep hip flexion. So she can just lie in this position as her therapist has prescribed, or if the therapist chooses to do so, they can take a strap, slip it around the legs, and you're going to want to put the strap just above the knees. And again, to where when the knees are pulled apart, that it's as wide as the hip, like so. Feet go down level with the knees, still maintaining that kinetic chain all the way up into the hip in that line. And then she's going to pull out with about 30% of her strength against the strap. And she can either hold that if her therapist prescribes, or she can engage it and release with a 3-second hold pushing out. Again, this portion is promoting pelvic stabilization through the abductors. If the therapist chooses and recommends it, the strap can come off and we can use a block. So feet again level with the knees, put the block between the knees, and then she'll engage into the block, and she can either hold that position if the therapist chooses to, or she can engage it and release with 3-second count. Again, only with about 30% of her strength. And then we're trying to do a little bit more work stabilizing the pelvis through the adductors. So repeat as your therapist has prescribed, and this is flexion abdominal position with block and with strap and without.